Good afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Ian Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Premier?
Thank you, Heather. This is a difficult day. We have some good news to deliver about opening up our province, about low case numbers, and that our vaccine program is on track and ahead of schedule. But for two Nova Scotia families, it's a very sad day. They've lost loved ones due to COVID complications. A man in his 60s from Central Zone who had his first dose of vaccine, but he contracted the virus before he developed his immunity. And a man in his 50s from the Western Zone who wasn't vaccinated, also died from COVID complications. To the families and friends of these two gentlemen, I'd like to extend my deepest condolences on behalf of all Nova Scotians. We are sorry for your loss. Our case numbers today continue to remain low with only 2, and that's thanks to all Nova Scotians for doing the work, following restrictions, getting tested, and getting out and get to your vaccine. Today we reached a new milestone for vaccines, reaching 800,000 doses into arms. And we're ramping up our second dose program. Today I visited the convention center, which will start vaccinating those walk-in for their first dose to continue to expand availability, as well as appointments that'll start on Thursday of this week. And I'd like to thank the federal government for supplying some of the resources, the Canadian Armed Forces locally here, as well as the Red Cross for helping us run this clinic. We're also extending hours in all of our current clinics to include more evenings and weekends. We're expanding drive-through capacity, and we're opening more community clinics. We are trying to provide as many options as possible for Nova Scotians to get out and get their shot as soon as possible. And we are encouraging everyone eligible to please get vaccinated. I'm proud to say that we are leading the country at more than 70% for first dose delivery. It's because we are doing so well that we can start to open up to our Atlantic neighbours. Effective tomorrow at 8 a.m., anyone from PEI or Newfoundland and Labrador can come into Nova Scotia without isolating or completing the safe check-in form online. But because New Brunswick opened up to the rest of the country, we are placing a modified restriction on anyone traveling in and out of that province, and Dr. Strang will provide more details on that requirement. We understand that restrictions are difficult, especially for those that have strong connections to New Brunswick, that have family and friends. But we want to make sure that our 65 ages and up are fully vaccinated before we move forward and have that open border to the rest of the country. We are doing so very well, and we are encouraging all those in that age cohort to make sure that you are booked to get your second dose. We're not there yet, but we believe we will be by the end of the month. So today we are also announcing effective June 30th, Nova Scotia will be open to the rest of Canada with a modified isolation. You will have to fill out our online safe check-in and provide proof of vaccine. If you have 2 doses, you'll have to isolate until you receive that negative test. With only 1 dose, you'll have to isolate for the 7 days and get 2 negative tests while you're in isolation. So we aren't there yet, but there is certainly light at the end of this dark tunnel. And now I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. I also want to send my condolences to the loved ones of the 2 people who have died. We have seen low case numbers lately, and yesterday we had our first day with no cases in months. But today's deaths are a reminder that the virus is still here and continues to have the potential for devastating impact on individuals and families. Nova Scotia Health has started sending exposure notices again. People may have seen those. This is to be expected given that there is still COVID activity and our own activities and contacts are increasing. The number of contacts connected to each new case is higher than we'd like to see, and the testing is lower than we'd like. We do need to stay cautious about our activities and our contacts, follow public health restrictions, and get tested while we open up. These things are not a guarantee, but they will certainly help to protect us until we can all get 2 doses of vaccine. At 8 a.m. tomorrow, our borders open to Atlantic Canada, and come June 30th, we will be open to travelers from all Canadian provinces and territories. And I know you've all waited a long time for this. As of tomorrow, anyone coming from PEI or Newfoundland and Labrador or Nova Scotians who are traveling there and coming back can come and go without quarantining or completing the online safe check-in form. This will not change when we open our borders more broadly, given PEI and Newfoundland are planning similar quarantine requirements for the rest of Canada. We are, however, treating New Brunswick differently because they open to the rest of Canada sooner and have less strict border requirements. So anyone traveling between New Brunswick and Nova Scotia will have some quarantine requirements based on their vaccine status and testing. Those who have had 2 doses of vaccine at least 14 days before arriving in Nova Scotia must quarantine until they receive a negative test result. And if travelers get tested the day they enter Nova Scotia, they should get their result in 1 or 2 days. Those who have had 1 dose of vaccine at least 14 days before arriving in Nova Scotia must quarantine for at least 7 days. They cannot leave isolation until they get 2 negative test results. And testing should happen on day 1 or 2 on arrival or after arrival, and again on day 5 or 6. Anyone who has not been vaccinated at all must quarantine for the full 14 days and be tested at the beginning and the end of their quarantine. Everyone entering from New Brunswick must complete the safe check-in form and upload proof of vaccination documents. They should also be prepared to show these documents at the border. And we will be monitoring these both at the border and online, the uploading of proof of vaccination. I know there will be a lot of questions about this, and there are certainly lots of questions, for instance, around traveling with children, and we will have more detailed information on all of this, on traveling into Nova Scotia from New Brunswick on our website very soon. Also, coming June 30th, anyone entering Nova Scotia from Canadian provinces and territories outside of Atlantic Canada will have to follow the same requirements that I just listed for New Brunswick. I also want to clarify the rules for seasonal property owners and permanent residents who have been allowed to come to Nova Scotia since Phase 2 started on June 16th. Until June 30th, anyone entering as a seasonal property owner or permanent resident must quarantine for 14 days. If you're in the middle of the quarantine come June 30th, you can modify your quarantine based on your vaccine status. Given the risks with the Delta variant, we need more time before we can open Nova Scotia to travel from outside of Atlantic Canada without restrictions. By next week, we should reach our target of having at least 75% of all Nova Scotians with at least 1 dose of vaccine. Today, we're at 71.4%. And that's the percentage of the entire population with at least 1 dose of vaccine. We will also have around 70% of Nova Scotians who are most vulnerable to COVID-19, those 65 and older, fully vaccinated with 2 doses in the near future. There have been a lot of ifs and shoulds and maybes with this pandemic. Nothing is certain, and I recognize that that's frustrating. But I'm optimistic about further opening our border and implementing other aspects of our Phase 3 reopening on June 30th and Phase 4 on July 14th. So now I'd like to talk a bit more about the good news about our vaccine program. Today, Nova Scotia, alongside Newfoundland, is leading the country in the first dose delivery of 71.4%, as I said, of the entire population with at least 1 dose of vaccine. The national average is 66.1%. We built a program to deliver vaccine efficiently, equitably, and flexibly. We took the time to get good, and then we've gotten fast. And we're gearing up to do the same for second doses, but in a much tighter time frame. Our vaccine rollout is a marathon, and we should focus not on how we start the race or where we are now, but on how we will finish it. With all the vaccine we're getting and the expansion of our program, we hope to have at least 75% of our entire population fully vaccinated by the end of August. This will make Nova Scotia one of the safest places in the world. So now let's talk about the next 4 weeks and our plan to get over 400,000 doses into arms in just 4 weeks. This morning, the Premier visited the new vaccination site that will open this week at the Halifax Convention Centre. Appointments there have already been loaded and they're being booked up very fast. This site is also where we'll try walk-in vaccinations for those who have not yet had a first dose. Our drive-through sites will quadruple their capacity, and we're now be able to vaccinate up to 4 people in a single car. All our other clinics will extend their hours and include more evening and weekend appointments. We're adding more staff at clinics and converting 2 primary assessment centers from testing to vaccination clinics, one in Halifax and one in New Glasgow. We're also opening a temporary community vaccination clinic in Berwick and a clinic at St. Martha's Hospital in Antigonish, which will complement the existing clinic at St. FX University. And the first of several vaccine clinics for newcomers will be held this weekend at the Newcomer Health Clinic in Halifax. And this is in partnership with the Immigrant Services Association of Nova Scotia and the Halifax Refugee Clinic. We're doing all we can to get vaccine into arms as fast as possible and to ensure all Nova Scotians get their second dose much earlier than expected. This is a significant team effort across the healthcare system, and I do want to take a moment and recognize that there are teams of hundreds of people who have been working flat out for the last 2 weeks to make sure that all Nova Scotians have the opportunity to get vaccinated in a very timely manner, and I want to thank each and every one of them. Invitations to Nova Scotians to reschedule second doses has created some strain on the booking system. The phone line has been very busy and available appointments are being booked up quickly. More appointments are being added every day and there will be appointments for everyone who wants one. So please be patient when trying to rebook, whether online or by phone. Please do not go to the booking site or call to switch your appointment unless you have received your email invitation. This slows the system down for those who have been invited to move their appointments up. You will get your turn soon. And I also want to reiterate that there is no difference between Moderna and Pfizer vaccines. They are both mRNA vaccines and both very effective. If you find an appointment, book it, regardless of which of these vaccines is available. The sooner we all get our second dose, the sooner we can return to normal. Nova Scotia has had many successes in this pandemic. And while we haven't done everything right, we have been recognized for our response, for our swift and firm closures and cautious reopenings, for our testing program and for our strong economic recovery. And I believe we will also be recognized for our vaccine delivery program. 2 doses of vaccine is important to protect us from COVID-19 and its variants. It has other benefits as well, and we're seeing that as provinces open up and loosen border measures and travel restrictions. For travel, 2 doses of vaccine means no quarantine or limited quarantine. Having as many Nova Scotians as possible with 2 doses of vaccine is also key to safely reopening. We're all in this together, and we need everyone who can to get vaccinated. So get your vaccine twice and follow public health measures, and let's have a great summer together.
We'll now take questions from media in the room and on the phone. We'll do 1 question, 1 follow-up in the time we have allotted, starting with CBC's Mike Gorman.
Premier, New Brunswick's plan isn't new. We've known about it for the better part of a week. Why have you waited until the eve of reopening to the Atlantic provinces to tell people about this plan, given that you surely would have known that people here and in New Brunswick would have been making travel arrangements to coincide with Wednesday?
So we were looking at the plans since last week when we just found out about their plan to open to the rest of the country, and we've had many discussions, Dr. Strang and I, over the last number of days, and we learned more about their restrictions at their border or lack thereof. But we think that this is the right place to be, and the decision was made today.
Dr. Strang, you mentioned about efforts to boost vaccination rates, and as I look at the website today, it still remains fairly low for folks under 40, although admittedly they've had access much more recently than others. What, if anything, about the rollout strategy do you think needs to be adapted to try to get those numbers boosted? And I wonder if you could also comment at all about the thought process behind not requiring parental consent for kids under 18 to get a vaccine.
So two questions there. So we know, looking at our and I talked with the vaccine folks this morning, those 35 and up, those age group 35 and up 30 and up, are at least, all of those age cohorts are at least 80%, many of them into 90%. And the 12 to 17-year-olds are doing very well in the 70s. The 18 to 30-year-olds are in the around the mid 60% so far. So we have a bit more work to do, but they're still doing well. They're still booking appointments. We know that in the Halifax area, there's very good uptake in all age groups. So what we're looking at is what we do, especially outside of Halifax, to get especially that's 18 to 30-year-olds, especially males. So one of the things we're doing is going to start to be working with large employers such as Michelin around immunizing in the workplace. Many of them are that age demographic, younger males working there, and by focusing on them in the workplaces, setting an example and in their communities. So we're still better than most provinces in all our age groups. We know that younger, especially male age group, we need to pay some particular attention to, and we are doing that in a number of ways, and we'll continue to monitor that carefully.
Next, we'll go to Tim Bousquet with the Halifax Examiner. Oh, sorry.
On vaccination. So this isn't new. First of all, anybody who is judged to be a mature minor has the right to give their own consent for any healthcare procedure. This is not specific to vaccination. We have always, in our school-based immunization, said that we ask for consent from parents, but if the consent is not there in grade 7, whether they're usually 12 or 13 or sometimes even 14, if it's the judgment of the healthcare provider that the individual in front of them is what we call a mature minor and is judged to be able to understand information and give their own consent, they are allowed to do that. And that's exactly the process we're going to be following for COVID vaccine. We will ask for parental consent, but if people are judged to be a mature minor, they can give their own consent. And that is not unique to COVID vaccine. It's not unique to vaccines. It's a principle that's been here for a long time in the healthcare system, and not just Nova Scotia, across the country.
Okay, Tim.
Dr. Strang, you said in your comments that you would address this. I'm asking you because I've had hundreds of people today alone ask me about children crossing the border from New Brunswick who are too young to be vaccinated, and how that will apply for their self-isolation requirements. And I guess the same question is going to be related to opening up to the other provinces. Can you tell us anything about that?
Yeah, and there's every circumstance is different, though there'll be a lot more information on our website, but the basic principle is that if there are children and youth traveling with, whether it's a parent or a guardian, with an adult, their quarantine status will be driven by the least vaccinated parent that's with them, or a adult that's with them. So let's take an example. You have 3 kids that, with their parents, one parent has 2 doses of vaccine, one has 1 dose of vaccine. The quarantine requirements of the kids will be driven by what's required for the parent who's got 1 dose of vaccine. So that's the general principle. I would ask people to go to the website. We're going to, there's lots of specific circumstances that I can't get into right now, but there'll be lots more information. But that basic principle, the least vaccinated parent drives what the quarantine requirement is for their parents.
Thank you for that. I asked you last week, I'm going to ask you again. Can you tell us what the status is with the COVID illnesses and deaths related to the non-COVID unit at the Halifax Examiner, or at Halifax Infirmary, rather?
I don't have an update on specifically attributing cases or contacts to that.
Moving on, we'll go to All Nova Scotia. Madeline?
This is for Premier Rankin. Today, the Newfoundland government has emailed us confirming that tomorrow they're going to accept everyone from Atlantic Canada, including New Brunswick. So I'm wondering, how are we going to police this? There could be loopholes where someone goes from Moncton to St. John's to here, or even go from New Brunswick over the bridge and take the ferry here. So how are we going to police this?
So we would ask that people don't look for loopholes. Obviously, we're not going to be able to catch everybody. This is about spot checking those that are coming through, and that's part of the reason why we thought that we should have this protection mechanism in place, because at the New Brunswick border, my understanding is there's just spot checking, people coming from all different provinces. So the process will remain in place, that they have to come in through and have the safe check-in. If you're coming from PEI, obviously you can drive through New Brunswick, and if you're not stopping in New Brunswick, then you can come right in if you're from PEI. We recognize some people will try to go around the rules we have in place, but that doesn't take away our efforts to try to keep Nova Scotians safe as we continue to roll out our second doses.
Madeline?
Thank you for that. And my follow-up is, you said in the past that the businesses and the public, they need notice of changes, and this is coming within like less than 24 hours of the bubble is supposed to open. What do you have to say to people who might have planned to visit their family in New Brunswick, and now in less than 24 hours might have to cancel that again?
Yeah, so it was late last week, Thursday, I said we'd have to go back. Once the revelation that New Brunswick was opening up, I was clear that we had to check to see what our plan would be next Wednesday, which is now tomorrow. So we did take the time to find out what their borders parameters are, what they're doing for checking people coming in, monitoring our uptake of vaccines into Nova Scotians' arms. So we did all that. And it's regrettable that we have to have something in place with New Brunswick and our own Nova Scotians that are going to New Brunswick and coming back in. But we have to put safety first, and I'm not going to take chances. This is a cautious approach, and we just need more time. We'll be monitoring, Dr. Strang and I, the epidemiology in New Brunswick as they start to open up more aggressively than the rest of Atlantic Canada. Next, we'll go to Lindsay Armstrong with the Coast.
Thank you. Premier, you said your decision on these New Brunswick restrictions came today. I'm wondering if you can help us understand what changed and what specific new information you learned within the last 24 hours. And I'm also wondering if you can tell us about what your communication is like with Premier Higgs.
Yeah, so it was finalized today. Over the weekend, we had conversations about where we should be going with our restrictions come Wednesday. So I said last week that we would be looking at that. There are some that chose to take chances that Wednesday we would have no restrictions on New Brunswick, but I think I was very clear last week that I was surprised by that decision and that we would have more to look into when I was asked the question. And so we did that. We took our time to fully consider whether we needed full 14-day isolation or if we could have a modified isolation period for those that are vaccinated. So that's what we did, and other provinces have other requirements. PEI has a requirement that you need one vaccine from Atlantic Canada, and they have testing requirements as well.
Go ahead with your follow-up, Lindsay.
Thank you for that. Given the impressive ramp-up of our vaccine program, especially with a jump in second doses over the last couple of days, I'm wondering if perhaps Dr. Strang can help us understand why we still feel the risk with more than 75% of our population vaccinated now. And with that, is that not enough sort of reassurance that we might be able to change it to single-dose New Brunswickers getting tested at the border instead of having them quarantined? Was something like that considered given our high vaccination levels?
All those things were considered, and the fact is we still have the Delta variant that's very prominent in other provinces, and so as many have said, as soon as they opened up the border to other provinces, that opened up our border. So we need to consider the fact that when you have one dose, that is a lot less protection against that variant. And I'm not ready to write off any cases. We just announced 2 deaths today, sadly, and I'm not going to take the position that we're going to take any more loss of life here in Nova Scotia for the sake of just opening up 1 or 2 weeks early.
Now we'll move to the telephones. Canadian Press, Keith Doucette. Go ahead, Keith.
Hi, Dr. Strang. I'm wondering, we found out today that we are opening for the rest of Canada on June 30th. So I'm wondering what the implications of that are for New Brunswickers. Are they still going to be in this kind of iffy area? Or, as the Premier said, are you going to base it now, 2 weeks from now, on what you find out about their most recent epidemiology?
So right now, we're planning on what we're putting in place today for new people traveling to and from New Brunswick, Nova Scotia. Is what the rest of it will apply to the rest of the country come June 30th. Whether we're able to modify for those traveling to and from New Brunswick, Nova Scotia, as the Premier said, we're going to watch the epidemiology in New Brunswick very carefully. They're now about a week into their reopening. We need to watch that for at least another week, which takes us close to the 30th, and we'll see. Are we comfortable that we can actually be less restrictive with travel to and from New Brunswick? So we'll continue to watch that really carefully.
Go ahead with your follow-up, Keith.
Yes, so Dr. Strang, what do you say to those from New Brunswick? And actually, I'm hearing from a lot of people today, through various means, that they feel that these requirements are somehow punitive for a decision that their own officials made that was also pitched as being based on science. I understand there are differences between perhaps the way you and Dr. Russell see things, but talk about that and whether you think maybe politics have gotten involved in decisions on either side of the border.
Well, I'm not going to speak to decision making and what was brought to play in New Brunswick. We've been very clear, the Premier and I here in Nova Scotia, that we're well aware that, as the Premier just said, that for the Delta variant, you need 2 doses of vaccine to provide good protection. And so we're focused on having the right levels of protection for Nova Scotia while we build as quickly as we can that 2-dose coverage. It's unfortunate that people feel that it's punitive, but we're doing what we need to do to keep Nova Scotians safe. This should not come as a surprise for anybody. We've been talking about this for the last 2 weeks. People were aware of New Brunswick making different decisions, and we've indicated that we were concerned about that and would have to think carefully about what was necessary to keep Nova Scotia safe. And that will always be the focus. What do we need to do to keep Nova Scotia safe?
Moving on, we'll go to CTV's Natasha Pace. Go ahead, Natasha.
Thank you. Can you, Premier or Dr. Strang, could you talk a bit about how you will specifically be monitoring people who arrive in Nova Scotia from New Brunswick?
So we have a team of folks both who monitors the digital check-in and how we do some monitoring of what people are uploading and making sure they're uploading valid proof of vaccination. We'll also be doing monitoring and people can be stopped at the border. And so one of the key messages that will be to tell people is that even while they upload proof of vaccination as part of their safe reentry, they absolutely need to bring that proof of vaccination, whether it's on a phone electronically or at a piece of paper, because they may well be asked at the border to validate, to show that proof of vaccination. And if they do not have it, they risk being turned away.
Go ahead with your follow-up, Natasha.
Thank you. Dr. Strang, from my understanding, Nova Scotia is set to receive about 250,000 doses of Moderna by the end of this month. Was this shipment unexpected, and how will it help with the push to get all Nova Scotians fully vaccinated by the end of August?
So we learned about this about 10 days ago. It was a Thursday. We learned about it at very short notice, and that's why I said the vaccine planning team has been working flat out for the last 10 days. This extra amount of Moderna, now it's been offset a little bit. We're getting less Pfizer in the week of July the 4th than we initially anticipated, but we're getting about 400,000 doses of vaccine, or slightly more than that, over the next 4 weeks. It's that amount, and we thank the federal government for that, which allows us to significantly move up the time frame for people getting their second dose of vaccine. I'm hearing many stories of people that they're moving up their second appointment anywhere from 4 to 6 weeks. And it puts us in a position by the latest end of August that we have very high doses or very high coverage rates of 2 doses of vaccines for Nova Scotia. So ultimately, though, this is about Nova Scotians. We've got vaccine supply. We've got a program in place that'll get you that vaccine, but we need you to make your appointment, get to the clinic, and get that second dose. And if you haven't had your first dose, get your first and then second dose into your arm.
Moving on, we'll go to the Herald's John McPhee. Go ahead, John.
Thank you very much. This is for Dr. Strang. You said in your remarks that Nova Scotia has done well during the pandemic, but we haven't done everything right, you said. Just wondering, what would you what would you differently? Sorry, what would you do differently?
I haven't had time to stop and talk about that. I mean, in a complex response over 18 months, nobody's going to get everything right. But we will do a proper debrief and lessons learned over time when we're in the right space to do that. Right now, we're still focused on the final steps in our response to COVID.
Go ahead with your follow-up, John.
Thanks. This is regarding the new 28-day protocol for people between the first and second doses. You're aiming to get a 28-day interval for people who received AstraZeneca. Now, a lot of people got this shot in April, and that 28-day delay obviously won't be possible. So I'm just wondering, when considering a lot of people will have a separation of months before their second shot, should they be concerned?
No, I mean 28 days is the minimum interval for all these vaccines. So you have to do at least that 28 days. That's the NACI recommendation. We're still gathering more data on different outcomes depending on when you receive your second dose. But we know that 28 days gives you a good immune response, and it's far more important that people get their second dose as quickly as they can, respecting that 28-day minimum, rather than waiting for some other date when we actually don't have any. There's no good data worldwide which would say what is the optimum interval between first and second dose. So we know that the 28 days is the necessary minimum, and it's most important that we then get as many people immunized with their second dose as quickly as possible.
Moving on, we'll go to Global's Alicia Draus. Go ahead, Alicia.
Thank you. This week, the federal government announced that fully vaccinated Canadians will be able to enter the country without self-isolating starting on July 5th. I'm just wondering what Nova Scotia will do in terms of, Nova Scotians potentially coming back from international destinations. Will they be allowed in the province without self-isolating, or will they kind of have to follow this new modified self-isolation? Can you just elaborate on that, if they've been fully vaccinated?
Yeah, that announcement was made yesterday. We're all along, we've said we will, and it's the first detail of a date from the federal government. We'll continue to work, as we've always said, to align our Nova Scotia border requirements with federal border requirements as well.
Go ahead with your follow-up, Alicia.
And just in terms of proof of vaccination for those coming into Nova Scotia, there had been talk about creating some kind of vaccine passport to make sure that there's no fraud. So just wondering where we are on that and what's going to be accepted even starting tomorrow for New Brunswickers coming in to prove that they are fully vaccinated.
So we're asking people to have, every province is giving some form, whether it's a piece of paper or some electronic information that you can use. That is your proof of vaccination. We're asking people to upload that in their safe check-in form and to bring that copy, whether it's paper or electronic, with them on person when they come to the border. There's a lot of discussions and work at a national level that Nova Scotia is involved in about being able to have electronic exchange of vaccine information, starting with the provinces, and Nova Scotia is one of them, that are using Can Immunize as our electronic data tool to get to where all our vaccine information goes. But that's a longer term project over the next number of months. All the people I talk to, my colleagues in the digital IT world, say that is likely in the fall when we get to that. In the meantime, each province is looking at how we can the best we can in requiring people to upload information and then have proof of vaccination with them as they come to the border.
And next we'll go to CBC's Jean Laroche. Go ahead, Jean.
Good afternoon, gentlemen. First off, I'd like Dr. Strang to explain the rationale for asking people who have been double dosed to self-isolate until they get a negative PCR test. According to figures on the Nova Scotia government webpage, only a small fraction of either the deaths or hospitalizations are for people fully or partially vaccinated. As you know, Dr. Strang, unprotected Nova Scotians make up the overwhelming majority of people who have died or needed hospital. Given that, how do you explain the rationale for continued isolation for people who have had either one shot or two?
That's still, and even people have 2 doses of vaccine, it doesn't mean that there is no chance of them actually being infectious when they come into the province. So we still need to have that test on arrival and then stay quarantined, and it's at the most it's probably 48 hours before they get that test result back. And we're looking at that right now. We still have work to do to increase our coverage rate with second dose of vaccine, especially for those who are 65 and older. So we need to, like all things, as we increase our vaccine coverage rate, we'll look at the need for that isolation, and maybe we remove that once we're at a higher place or a higher level of vaccine coverage with 2 doses. So we'll continue to evolve our border measures based on 2-dose coverage in Nova Scotia, as well as the rest of the country. It's also important that we keep our eye on what is the coverage rates for 2 doses of vaccine in other provinces, and we need that to be increasing as well.
Jean, do you have a follow-up?
I do indeed, and this one's for the Premier because Elizabeth Smith McCrossan, who is the MP for the Cumberland area, has just posted on her Facebook page suggesting that the change that you've announced today, the modified isolation for New Brunswickers, is such an affront to people in that area that they should shut down the Trans-Canada. Your thoughts on that?
So we're going to continue to focus on protecting Nova Scotians, and this measure will provide the protection that public health is asking for as we start to reopen our economy. It was my hope to have all of Atlantic open. I proposed the date of June 23rd and had agreement with 2 premiers. I wasn't able to get that full agreement from one of the premiers, but because of that, I need to make sure that we're focused on the needs of Nova Scotians, and it's regrettable that we're in this position where we have to have a little bit more of a requirement from people coming in from New Brunswick, but that's needed right now, and we hope we're in a better place in the weeks ahead.
Moving on, we'll go to the Amherst News and Daryl Cole. Go ahead, Daryl.
Good afternoon. My question is for the Premier, and it's to follow up to my colleague's question about the border. Up here in Amherst, people have been separated from families for about 6 months. They were really hoping for things to sort of return to normal tomorrow. People I've talked to today in Amherst are really angry and really hurt. I guess, what message would you have for those people along the border who are facing more issues trying to reconnect with loved ones?
Yeah, that was my hope as well. That's why we advanced by 1 week. The original schedule was June 30th for Atlantic Canada. We worked really hard to get to a point where we were able to start to open up earlier. And again, it's just not feasible for us to take the risk levels with all Canadians traveling in through to New Brunswick, and we just can't take the same level of risk that New Brunswick is prepared to take right now, but we hope to be able to do that soon. We'll continue to watch our own epidemiology and what's happening in New Brunswick very closely, and continue to get our vaccine coverage up higher.
Go ahead with your follow-up, Daryl.
My follow-up also for the Premier is regarding the announcement last weekend on the announcement with the ferries and removing the travel fees on all provincial ferries. And to let people up here asking about the Cobequid Pass, and over the years numerous promises have been made to remove the tolls on the Cobequid Pass, but there was no mention of that last weekend. I guess, why weren't the tolls included, and when will they be removed?
So the commitment has been once all the bonds are paid off for the project that we would be removing tolls for Nova Scotians at the Cobequid Pass, and that's still that's the commitment that we'll be making once that takes place.
Moving on, we'll go to Andrew Waugh with the Telegraph Journal. Go ahead, Andrew.
Hi, Premier. I'd just like to know, did you let Premier Higgs know that this decision was coming? If so, when, and how did the conversation go?
No, I didn't.
Go ahead with your follow-up, Andrew.
Why not?
I tried to get a hold of the New Brunswick officials last week. We were hoping to learn more. Myself and other premiers in Atlantic, we were supposed to have a call last week, and that never happened. But we had to modify our isolation requirements based on their decision to open up to the rest of Canada.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you. We are excited to welcome our Atlantic neighbors. It's been a long time, and while these restrictions are related to New Brunswick, it will be good to enjoy less restrictions in the Atlantic region. It's an opportunity to reunite with friends and family, and for those who have loved ones in New Brunswick, I can understand that it is frustrating that you can't move around freely in and out of the province without modified isolation. But the Delta variant is active, and we have to be cautious. We just aren't ready to open up to the rest of Canada right now. And because New Brunswick already has, we have to take some more precautions to protect our citizens. This is the best and safest approach until the end of the month, when far more of our 65 years and up are fully vaccinated. For now, we are easing in and opening up. It's a great time to remind ourselves of our welcoming spirit. We want tourists to come and enjoy our beautiful province. We want families and friends to get together. Yes, there will be requirements, but Nova Scotia is ready to open its arms to visitors. So start making plans, and who knows, maybe when you come, you'll just stay. Thank you.